What's up, big guys? This is your boy Miguel giving you your daily dose of radiation. Today's video, we're covering a typical day working at the Main Radiology Department. So, to give you context, I am a night shift Xray tech. Been doing it for 4 years. I do dabble in day shift, work a lot of overtime, so I am versed in those worlds. So, the Main Radiology consists of mainly fluoroscopy and occasionally here and there some x-rays, but it's mainly fluoro at the main. That's the bread and butter. Scheduling patients both in-house and people outside of the hospital that need stuff done. From what I've gathered, my knowledge of asking the managers, both being a student, both of everything at this job, they have a set way they like to do their stuff. For instance, they usually have a set time frame. They have like a 30-minute block for certain exams, an hour block for certain exams, and an hour lunch break, typically. So what I've noticed is they try to get all the speech therapy, all the with speech therapists usually likes to do their stuff in the morning, so we'll get in contact with them and see when's the best time to do the swallow study exams. So usually those take up the morning part, and then following after that, we have all the people who are scheduled throughout the day. So if we have a lumbar puncture, or we have an arthrogram, or if we have enemas and stuff, usually that is everything between, I'd say, like 10 all the way to about 1, 2, 3 ish o'clock. And then the other time frame between like 3 to 5 is kind of any patient in-house who isn't stat and it's just an extra one that can be done. Usually gets, if we have time, gets caught in at the very end, or sometimes at the early beginning. It will get thrown in the early beginning if it's slow. Monday are typically the most busiest and hectic of days at our department of the Main, because everything that got stacked over the weekend kind of gets shoved, and all the doctors order everything for Monday. So you do get slammed on Monday. Of all the days, that is the heaviest workflow for them. Once again, they get an hour lunch. Other Xray departments only get 30 minutes if you're lucky. Sometimes even less, because if it gets busy, you gotta quit munching, so you have to go save people's life. So there's that to deal with. For the most part, it's pretty. Our hospital has 2 main rooms, so there can be 2 stuff going on. It all depends. Usually the RPA at our department kind of holds down both joints. Sometimes we may have to bring the radiologist to actually do stuff. For the most part, our radiologists don't like really doing the stuff. Mainly all that gets outsourced to the RPA. They kind of hold down the joint at ours. Sometimes we do have to need them if we have to do both stuff at the same time. But it's pretty chill. It can be hit or miss. Sometimes they're like really slow and don't have anything going on. So sometimes what happens is one of the Xray techs in there will either head on to the 2 other departments. We have the emergency room, and then we have the outbuilding, the patient outbuilding. They'll head over there and kind of help if it's slow. And then just have one tech up there just in case they need stuff done. But yeah, it's you do the usual. You make sure everything's stacked, everything clean. Supplies and stuff, you kind of had to keep your head count. We'll tell the manager if there's stuff running out and check expiration dates. And there's more like the house busy work type stuff over there, because you have to, because of all the supplies and stuff, you gotta kind of keep account of. And yeah, it's been your Miguel. See you on the next one.